Ambulance service, is the patient breathing?
She's having a seizure, and it's the second one with about an hour.
I've been vomiting blood up. About 2 sinkholes.
She's had a stroke before, and she reckons she's starting to have another stroke.
Start in the morning, eh? I know.
We're on board with the paramedics of West Midlands Ambulance Service.
This job changes every day.
Can we get fire or police, somebody with bolt cutters?
Painful even when I'm pressing here.
Saving lives and making a difference every day.
You say the patient's been stabbed?
In a medical emergency,
You're all right.
6 million people rely on them.
You can go to people giving birth, then in their most traumatic time of their life.
You could be having a bleed on your brain.
OK, mate, move in.
Filming simultaneously with 7 paramedic crews.
Got loads of things going on.
Take steady breath for me.
Capturing life on the front line.
There's no price you can put on saving somebody's life.
Ready for a fantastic day?
Yeah, hopefully, yeah. You never know what you're going to get.
No, that's it.
No.
It's 6:30 in the morning and the crews of West Midlands Ambulance Service are getting ready to start their shift. But they're already thinking about dinner time.
What have you bought me for tea then?
I've got a jack and potato, cheese and beans.
Oh, I love you. I'm so excited for that.
I know. Come prepared today.
You have?
I have.
I hope we have a nice day though.
We will.
Good jobs, good dinner.
As they set out on the road, there's not a hair out of place.
What's the worst haircut you've ever had?
Do you remember when I shaved my head? I looked like a fairy egg. It was awful.
Fairy egg.
I had lines in my hair once.
That's not something you should be admitting.
I thought,
Did you have the eyebrow slit as well?
No.
So when I was probably about 10 or 11, I was going for a family photo shoot. So I decided to get some nice scissors, pulled the whole front of my fringe forward and just cut it pretty much to the scalp.
We've got a set of hair clippers. Set it to like, I don't know, 4 or something like that. Started getting into it. Oh yeah, this is doing real well. Anyway, next minute I look and the blade grader has collapsed to like 0. You had snails?
No. Snails live in the grass and on the ground. They should not be in someone's mouth.
I had camel when I was in Saudi.
A what now?
Camel.
No. See, like, I eat beef and chicken, but you like camel? Well, I don't understand
Only had it
that.
once.
Yeah, but was it nice?
It was a bit gristly.
Oh.
But it was OK. Yeah, at least I tried it.
No.
No?
Mm-mm. I like other, like, French stuff.
Like?
Pain and chocolat and all them, but just not snails.
Ambulance service, is the patient breathing?
Yeah, she is.
What's happened, please?
She's had a stroke before, and she reckons she's starting to have another stroke.
How old are they, please?
48.
Is it at all possible for me to speak to a direct? My eye's drooping, my right side is drooping. Pins and needles all in my right side, my arms, my legs.
We are going to a female with a right-sided droop and pins and needles.
It's a bit young for a stroke, 48, I mean.
Strokes can be quite detrimental to a patient, especially long-term effects afterwards. They can have issues with their mobility and need assistance with their daily activities. When we first got this job, a 48-year-old stroke is not typically the textbook stroke that you normally go to. They're normally in elderly patients, so it was quite surprising to see her age. Hello, my sweet. You're Abdul and CJ. How can we help?
Right side weakness and I keep straight from
Okay. What time did this start?
About an hour ago.
You had this before?
Yeah, I had a stroke in 2017.
Let's pop this on your arm, darling.
Can you feel me touching your arm?
It's just pins and needles.
Just pins and needles.
48-year-old Jane has had 2 strokes in the past. When her family noticed the right side of her face had a pronounced droop, they called 999.
Can you move them at all?
I can lift it slightly.
Okay, is that worse than you normally can? Okay.
As we walked into the room, it was quite obvious something had gone on. She had the facial droop. She appeared to be slumped to one side slightly, but initially you don't know if that's normal for her.
Can you squeeze my fingers at all? Try and push me away.
When the blood supply to part of the brain is interrupted, it can result in a stroke. CJ carries out a series of tests to see if that's what's happened to Jane.
Cool. If it wasn't reactive, all right. You said you got a headache. Okay, so that's all when the weakness went really bad. Okay. You say you got a bit of blurred vision at the minute. You've probably won yourself a trip up hospital.
Before work, I had 4 sandwiches and a bowl of fruit.
4 sandwiches and a bowl of fruit?
Yeah. So,
4 sandwiches?
Yeah. It's not that many sandwiches. I think that's an appropriate amount of sandwiches.
The problem is that everyone doesn't know about is the fact that an hour later you will be eating again. And then an hour later you will be eating again, and then again. And you'll pull out a chocolate bar and you'll pull out a packet of crisps.
No,
I eat fruit.
You have about 12 packets of crisps a day.
Some days.
What's the reason for the call today?
My daughter's breathing rapidly. She's only got to move to the toilet or walk down a few stairs and she's really, really struggling for breath.
She's struggling desperately for every breath now?
Yes.
a 15-year-old female with breathing difficulties. You never know, mate. It might be a life-threatening anaphylaxis.
It might be.
Or asthma.
When a job comes through as a 15-year-old with breathing problems, we always jump straight to worst-case scenario, wondering what else there is going on, what's caused it, what's her history. But all those things you just have to play on your mind until you get there.
Hello. In here? Yeah. Oh, yeah. What's your name, Daddy? Jess.
Lovely.
I'm Marius. This is Ben. How can we help?
She's had breathing difficulties since Tuesday.
Okay. Can I have a little feel of your wrist?
She's been to A&E.
You feel quite warm.
15-year-old Jessanne has been struggling to breathe. 2 days ago, Mum Lisa took her to A&E, but her symptoms have only got worse. Sister Jolie is also with her.
What did A&E say?
Give her intravenous antibiotic.
Chest infection.
Yeah, and throat and the ears look swollen as well.
Okay, bit of everything going on. Am I okay to have a little listen to your chest to try and take steady breaths for me?
She's only got to walk from here to the toilet, and this is how she's for the next 10 or 15 minutes.
Jessanne was clearly struggling with her breathing. Her breathing rate was quite elevated. She appeared to be in some pain and discomfort. It was unclear from the start what the issue was, so we had to do a full set of observations to try and get to the bottom of it. Where's the pain in your back? Just round your side? Any pain in your tummy, any pain in your chest?
Just my chest.
Just your chest. Is it pain or is it tightness?
Both. Like it's like a sharp pain, but it's not tight as well.
Okay. If you take a deep breath, does that make the pain worse?
Yeah, it's better to take a deep breath.
Right, what I'm going to do is I'm going to trace your heart. Just try and steady your breathing as much as you can, just for about 30 seconds. I know it's going to be hard.
Ben and Marius run an ECG to check for any problems with the electrical activity in Jessanne's heart.
Like I said, just try and settle that breathing. Nice big deep breaths in, and then hold it for a few moments, and then breathe out slowly. How bad would you say the pain is in your back? From a scale of 1 to 10, 10 being the worst pain you've ever had in your life, 1 being no pain at all.
About a 7.
About a 7. Have you had this pain in your back before?
Not this bad now.
But you have had it before, just not as severe.
You've just suffered lots of water infections before.
Have you ever had kidney problems?
No.
Nothing like that? No. I've got a feeling it might be a bit of a kidney infection brewing, just from where the pain is. Now, I think the pain might be causing a bit of the breathing kind of issue as well.
You got any pain anywhere? No.
To the south of Wolverhampton, paramedic Abdul and technician CJ are with Jane, who they suspect has had a stroke.
Can I take a drop of blood, darling? Is that okay? Yeah? Right, sharp scratched on. Jane had had previous strokes. She still had weakness on one side from a previous stroke. The symptoms she described looked like a new stroke.
We're going to try and roll you that way a little bit. We'll get this board in. It ain't going to feel nice, not going to lie. And then we'll try and get you across. All right?
You've got full power in this leg, haven't you? All right.
Yeah.
Ready, steady, slide. There we go.
All right.
I'm going to sort of slide this out, so we'll lean that way. And we'll just work it out. With her previous strokes, she's quite weak on one side. So myself and CJ had to do most of the moving to get her onto a chair. She wasn't really able to help that much. I'm just going to move your leg back. There we go. There we go.
If Jane has had a stroke, the sooner she receives treatment in hospital, the greater the chances of reversing any damage.
Onto the side here, Don, and I'm going to rotate your legs for you. You okay? 1, 2, 3. There we go.
Strokes can have a long-term effect on that patient, and I think with Jane's medical history with the previous strokes, I think she was worried that she was going to have more long-term damage from this one. Hiya, it's CJ with the ambulance service. I was wondering if I could pass a stroke alert to you, possibly, please.
CJ updates the stroke team. If Jane is having a stroke, clot-busting drugs will need to be given as soon as she arrives.
I have a 48-year-old female with complete right-sided weakness. She's had 2 previous strokes in the past. Today, since 10:30, she's developed right-sided facial droop and complete right-sided weakness. She can move her toes barely.
Right, Dom. Anything changes? Yeah? Just tell me straight away.
Are you happy?
Yeah, get going. So we're just going to go on blues. Obviously, the sooner this is treated, the better the outcome. Yeah? Are you feeling tired or sleepy, or is this normally like you? When Jane started to close her eyes and wasn't actually talking to me, I was concerned in case the symptoms had got worse. So I was just trying to make sure that she still had her faculties and was able to answer me. And you are worried in case that she was getting worse in front of you. All you can do is monitor her and try and stabilise anything that you can before you get her to the hospital. All right, we're here now, darling.
In less than 10 minutes, Jane arrives at New Cross Hospital in Wolverhampton.
No change.
Alerted by CJ, the stroke team will be ready and waiting to treat Jane.
So she feels sleepier than she did before. It's dropping off as we were coming in.
So if we can't get the breathing settled, I think the best thing would probably just be to pop her up to A&E, get him to look her over again.
In Dudley, paramedic Marius and student paramedic Ben are with 15-year-old Jessanne. She has severe back pain and difficulty breathing.
In regards to your lungs themselves, they seem to be functioning perfectly fine. Your oxygen is absolutely spot on at 100%. They may decide to give us some different antibiotics. They might decide to maybe even dip the urine and investigate further. Are you okay to come back up to the hospital with us? Yeah?
She was showing some quite significant signs of an infection. Her breathing rate was elevated, her heart rate was elevated, and she had a slight temperature, even after taking paracetamol. So we knew from there that she was developing quite a severe infection, which is quite unusual and can be quite life-threatening in children her age.
1, 2, 3, lift. And down.
A bit dramatic, wasn't it?
It was a bit. Here we go.
For the second time this week, Mum and daughter are heading to A&E.
If you just want to sit on that chair there. Try and steady that breathing for me, darling, okay? And what time did this breathing episode start?
About 20 minutes before I rang you.
Just have another listen to your chest. Try and slow that breathing down for me, okay? Nice and steady. You're doing well, that's it. That's it, you're doing really well to control it, okay? We're not too far away.
After 4 miles, Jessanne arrives at Russell's Hall Hospital in Dudley.
Try and slow that breathing down for me, okay? Nice and steady.
Here, medical staff will try to get to the bottom of what's causing her severe back pain and difficulty in breathing.
I understand why the mum was concerned though, like that noise that she was making with the breathing.
It does sound very nasty to hear.
We'll see if we can find out what happened to her.
Black country phrases I need to teach you.
Go.
There's a black country alphabet, you know. There's a saying like it's black over Bill's mothers.
What does that mean?
So that means like there's like a dark cloud looming and it's going to start raining.
Black over
It's black
Bill's
over,
mothers.
So it's like it's black over Bill's mothers. Yeah, the black country has its own language.
Which you've tried to teach
Which I've tried to teach you. Babby.
Babby.
Rather than bait, you don't say baby, it's babby.
The babby. Bab.
Bab. You're right, Bab.
Oh, I'm you, Bab.
Oh, you, Bab. That was good.
Ambulance service, is the patient breathing?
She's breathing, but she's having a seizure. And it's the second one in about an hour.
Okay, and she's spitting at the moment?
Yes.
Just confirm you've got category 1 coming through as of 16. There was a breakdown.
Yeah, that's all received, thank you. And we are mobile. ETA 2 minutes. Fitting. Yep, so we have got a unknown patient, female, fitting. That's all we've got at the moment.
It's like, what's caused this? Is she like epileptic?
And fits are so, everyone is so different. Seizures are like so unpredictable. Just because you never know what to expect, and sometimes people don't react to treatment, and I think that's really concerning when you're out of hospital.
And we've exploited everything
we've only
done.
got a certain amount of things we can do. Oh God, it could be anything.
I'll take my drugs in just in case.
Just in case. Who's this young lady?
This is our daughter, Elizabeth. She's 29.
What's happened with Elizabeth today?
Okay, so she had a seizure while I was at work, so I came out.
She looks quite pale.
Yeah,
as well,
and she's
doesn't
just
she?
had another one.
29-year-old Liz appears drowsy as she recovers from back-to-back seizures. Mum Donna is looking after her.
What do her seizures present like?
Shaking,
Just going to pop some checks on you, sweetheart. All
Flailing,
right.
shaking.
Yeah.
She had a temperature or anything. She feels roasting.
She's really warm.
Yeah. When we first saw Liz, she looked quite pale, she looked quite clammy, sweaty, warm, so we were just wondering if she had an infection that was causing the seizure or if it was something else. Hello?
Yeah.
You've had a little seizure today, okay?
And how long did this one today last that we've called for?
Couple of minutes.
Couple of minutes.
Yeah, she hasn't had that many. They've just started in the past. I would say this year they've started.
Liz's seizures are sudden bursts of electrical activity in her brain, which briefly affect how it works.
Elizabeth, sweetheart, you open your eyes for me.
Hello.
There we go. Hello, darling. You've got the ambulance crews with you at the moment. I think you've had a bit of a seizure.
Lips went blue as well, which, you know, just...
Yeah, it's a bit. I bet you were scared. It was quite concerning that Liz's mum said her lips were turning blue, because that means that there's not enough oxygen being supplied to her brain. We need to understand why the seizure was lasting so long. Just look at this for a second. Open your eyes for me, sweet.
Open your eyes, Elizabeth. Come on. Come on.
Across the West Midlands, we're following 7 paramedic crews as they work a typical 12-hour shift.
We've been trying to get her into the recovery position, but she literally will not let us.
In Birmingham, paramedics Courtney and Parker are treating 29-year-old Liz, who's had multiple seizures. Mum Donna and Dad Paul are with her.
What happens when you try?
She was agitated, but the thing is, because
Sorry,
she
sweetheart.
doesn't remember them, you see, so she doesn't know she's had one.
When recovering from a seizure, patients often feel exhausted and confused. This is called the postictal phase and can last several hours.
I think because drinks
Just check your-
involved, unfortunately.
Okay.
Yeah.
And do you know when her last drink was?
No, I've been at work.
Has she been withdrawing at all from alcohol or anything?
No.
No.
Drinking or any substance abuse can cause seizures. She's got a good family support network around her, but it can be so hard to manage substance abuse. Elizabeth, we need to put some dots on your chest, sweetheart.
Okay.
Is that okay? Hello, sweetheart.
Hello. Do you know what's happened today? No. We think you've had a little bit of a seizure.
You've had.
Yeah.
You think your mum? Your
Leave
mum says you've had
those stitches on
to.
a second. I'm just going to be doing a heart tracing,
Can you
okay?
sit really still. You're just on your mum's lap, okay?
How does her colour look to you?
Well, she just looks very pale.
Pale.
Yeah.
How do you feel now, darling? We think you've had a seizure. You've had a couple today.
Why?
Do you want a hand sitting up, sweet? Yeah, up.
Ooh, relax this arm for me if you can. I'm just going to do your blood pressure again, okay? That's it. Do you feel dizzy or anything? Yeah.
It's a big relief when Liz is able to sit up and talk to us because it means that we can find out what's happened from her side of the story. We still need to keep assessing her because there's a chance that she could go and have another seizure.
What do you guys think the plan of action's going to be today? Is it going to be a trip up to the hospital?
I don't think so, no. I think my plan of action is to contact the doctor tomorrow and get some sort of something in place.
Yeah, I think there needs to be some more investigations, especially if there's been two quite recent.
Her observations are normal, but Liz needs tests to find out why the frequency of her seizures has suddenly increased.
So it's completely up to you what we do. You can come with us today, or your mum can contact the doctors, get some further investigation.
Maybe tomorrow. I don't know.
You stay here, see how you feel.
And then I'll ring for an appointment.
Keep an eye on her. If another seizure happens, just call us back.
There's lots of different factors. Drink could be one.
I don't think she thinks she's got a problem. I think maybe what she thinks is an alcoholic is somebody who gets up in the morning and starts drinking, but it's not necessarily that. She'll have maybe one day off, and I'm thinking, wow.
I can imagine it's quite hard for the family. We see this quite a lot within the job, quite a lot of patients that are dependent on alcohol or struggling to withdraw from alcohol as well. If you are drinking every day though, Liz, it might be that you are becoming a bit dependent on alcohol. It might be worth sort of speaking to the doctor about that and seeing if you can get any help, but to get the help, you've got to be willing to want the help first. Yeah, but that if you're having these seizures, alcohol can be a contributing factor. All right, so it's just something to think of. Yeah.
With Liz keen to stay at home, Courtney and Parker leave her in the care of her mum, with advice to follow up with her GP.
Take care.
Right. All the best.
Cheers.
Hopefully she'll get it sorted.
And like what her mum was saying as well about the alcohol, like hopefully what we've discussed and said
might sink in a bit.
Might sink in a bit because it is always different when it's your mum, isn't it? It's coming from like a healthcare professional or someone different.
It might help her a little bit.
Answering 999 calls from those having their worst day is not a job everyone can do.
How's his breathing at the moment?
What's the address of the emergency?
It takes a cool head to work out what's just happened and then decide on the best course of action.
We're the first port of call, so we've got to actively listen to understand the patient's needs and be able to get them the right help. Ambulance services. Patient breathing? Hello, is the patient breathing? Hello? Have you been in the road traffic collision?
Yes, I'm in the police as well, yes.
Okay.
Car, yeah, there's 3 cars involved.
There's 3 cars.
Yeah.
Okay. Are you the only patient, or are there multiple patients?
No, the patient is not me, it's the other one. The 3 cars and the other one is the one. He's in his own car.
So it's 3 cars that's happened.
Yeah.
Are there multiple patients? It was very difficult to figure out who the patient was, as there was a lot of background noise. We was very unsure on how injured the patient was because the caller was not being very clear. Are you the patient? Was you involved in the RTC or not?
No, it's somebody else.
Okay, is it possible for me to speak to him? Hello?
Hello?
Hello. Are you the patient?
Yeah, I am the patient, yes.
Okay, I've just got to ask you some questions to arrange some help for you first, okay?
So have you lost any blood?
You don't need to swear, so I'm just going to ask you some questions. Have you lost any blood?
Yeah, he's bleeding. I'm bleeding, yeah.
Is it dripping through?
Are you going to bleed me, bro? They're not listening to me. They're going to talk to the patient. What do you want me to do?
Hello? I haven't had many calls where people are having an argument or fighting in the back of the call. I just need you to stay on the line, okay? You still with the patient?
Yes, sir. I need a police, please. I'm in trouble. I think they're gonna attack me.
Is that the patient that's going to attack you?
Yeah. Oh, he's got his own relatives here as well, and I'm not going to say that too.
It is very stressful to hear a patient shouting and screaming down the phone because we don't understand what's going on yet. We don't understand what help's required, and it just delays patient care.
So move your fucking car, man. You have to move. How can I move that car, man? I'm gonna fucking show you.
Hello, operator.
As the call escalates, Demi refers it to her supervisor.
The caller said that he's with the patient, but he thinks the patient is about to attack him. Are you able to assist, please?
Hello, caller. Can you hear me? Yeah, hello.
Right, try and move yourself away from that situation if it's getting heated. Okay, try and move away somewhere.
He's cleared.
Just do his phone line when dead then.
Okay, perfect. Thank you.
Cheers, sweet. Bye.
We did send an ambulance, although it sounded like a fight had broken out because there was still a patient there in need of our care. Also, we would have just contacted police just to ensure that they know that a fight may have broke out and that we may need their help when the crew get there. I can't stop nowhere. Oh no! We're doing our whale calls again.
Originally, I think the whale noises came from yawning.
Yeah, I think you just do that like, and then it's like, oh, it's a whale, and then it's just stuck. Oh, you're gonna go. I can't really do a dolphin.
And so I just have a bit of a go. You're definitely the pro at all this. I just think you must spend hours doing all these different sounds.
I don't know where they come from.
Ambulance service, the patient breathing?
Yes.
What's the reason for the call?
Hard breathing.
How long has this breathing problem been going on for?
I came out of hospital last Friday. It's still the same. I got COPD.
Let's see what we have here. We have a category 2. He's 74 and he's got breathing problems. He's fighting for breath and he is known to have COPD. And we're 3 minutes away.
COPD is an incurable lung condition that makes breathing difficult.
When someone has something like COPD, they liken it to trying to get the air through a straw, or drowning, which must be really, really unpleasant, that they're not able to get that breath in or get that breath out. Very stressful for the patient.
It's just so scary, though, just physically not being able to fill up your lungs. Hello, I'm Danny and Lisa.
So, tell us why we're here today, then.
Hard breathing.
Finding it difficult to breathe? Okay, so when did that start?
Last March. A stroke, mini stroke.
Okay, last March.
74-year-old Stanley's lung disease is so severe, he breathes oxygen through a tube.
So we've been finding it difficult since we came out of hospital, but like in what way? With your breathing or?
Breathing. Well, the doctor Thursday.
What did the doctor say?
The doctor said it's the wrong way I'm breathing.
Okay.
Because I'm supposed to breathe in my nose and out my mouth.
When we got to Stanley, obviously he was quite distressed, and he did look quite pale and a little bit kind of flushed in the face as well at the same time. And I was quite concerned that maybe he had an infection.
When I got to work this morning, I obviously went in the locker room. It was like, you know, like on these horror movies where like sort of they've hidden someone in a cupboard and there's like sort of stuff coming out from underneath the door. And what I'd done is yesterday when I put the shower gel away, I hadn't like flicked the lid back. So it's basically gone all over the bottom of the locker. It's like seeped out. It was almost like
all dripping out the
It's
bottom
like a
of the
horror
locker.
movie.
Yeah, work does feel like a horror movie sometimes, doesn't it? With some of the jobs, especially at night, some of the people you meet.
Yeah.
Go
I
to
do
our
sometimes stand and think to myself, not sure why I do this job.
Why am I here?
Yeah, why am I
3
here?
in the morning going down this passageway?
Yeah,
Somebody's
yeah.
going to jump out in front of me.
Yeah.
It can be quite scary at night.
I just send George in first.
That's it. I'll try and send Neil in first.
Hello, ambulance service. Is the patient breathing?
Yes, I am.
You're the patient. What's wrong with you?
Yeah, I've got a problem with some internal organ. I've been vomiting blood up.
Have you lost more than an average mug full of red blood in the last 2 hours?
About 2 thinkfuls.
So we got a 59-year-old female, abdominal flank pain, and patient stated she has lost, it's saying 2 sinkfuls of blood in vomit. I mean, that is a lot. That's not going to be good. She's not going to be very well. So yeah, that's a big bleed.
There's quite a lot of conditions that can cause you to vomit blood. None of them are pleasant, and quite a lot of them can be life-threatening.
Hello there. How can we help you?
I've not been very well since Wednesday, vomiting and diarrhea.
Can I just get you on?
I just feel terrible. I feel sick. I feel shaky.
Yeah, she hasn't eaten anything for about 3 or 4 days.
59-year-old Ronnie called 999 after vomiting blood for 3 days. Friend Jane is with her.
So what's your medical history? What do you suffer with?
I've got liver and spleen and kidney failure.
So you've been on and off vomiting since Wednesday?
Every time I drink water, it just
can't keep it down?
No, or I go to the loo.
Yeah.
It's just black tar.
Okay. And am I right in saying you've had this before when you were in hospital, vomiting? And
Yeah.
what did they say has caused you vomiting?
They thought I might have ruptured something.
Ronnie looked really pale when we arrived. I was quite worried how pale she looked and thought she must have lost a lot of blood. And I was worried about her blood pressure. Have you ever heard of esophageal varices, like bleeding from like your throat? Have they ever mentioned that?
She did mention it earlier, but I don't think I've had that before.
Your blood pressure is on the lower side, but you've got what we call a good radial pulse.
I've been trying to drink and it's just coming straight back.
Esophageal varices is where the vessel inside of your throat becomes thinned and can bleed. And in most cases, it can be catastrophic. The fact that you're vomiting blood as well,
Yeah.
you know, we can only assume that it's down to maybe an internal bleed.
I mean, it will be a trip to hospital.
Yeah, I know.
You know that, won't you?
BP's a bit low.
Yeah, your blood pressure is a little bit low.
I'm not surprised.
In Malvern, technician George and paramedic Neil are with Ronnie. She has very low blood pressure, and for 3 days she's been vomiting blood.
We're going upstairs for a wee, so just nice and steady then.
Oh,
Someone's organised with the Christmas presents.
that includes a puppet.
I'm laughing, but I think you're serious, aren't you?
I am.
Oh, yeah.
I am.
It was quite sad how she bought Christmas presents 3 months before.
Yeah, I think...
Did she think that, you know, she might not be here Christmas time?
It must be quite a sad kind of thing to think, right, well, I'll go and get the presents now.
Yeah.
Just in case I'm not here.
Yeah.
George? Yeah? I'm thinking, as long as everything's OK after we've been to the toilet, we just go straight to the motor.
Yeah, OK. It makes sense if she's walked to there and...
Yeah.
I'm surprised she's... Wow, with the blood pressure...
She feels a bit lightheaded, but we might as well just...
OK.
Go with it. Change your plan, I think. She feels a bit squiffy, so I think we'll just...
Are we going to lie on it?
Well, yeah, I'm just thinking I'll get a line in now and we'll just... It's rude not to, really.
Sorry.
It's OK.
I ain't wasting time.
No, you're not wasting our time. It's quite natural sometimes for patients to apologise about calling an ambulance. But at the end of the day, we're there to help them. Do you mind if I pop a little cannula in your arm? Right, so you're going for a sharp scratch, OK? Here we go.
To stop Ronnie feeling faint, Neil injects fluid directly into her bloodstream. This should help raise her blood pressure.
What's that BP come back as? 91.58, so it's still on the lower side. What we need to do now is basically get you to the motor. So what we're going to do is leave this tube attached, OK?
Yeah, I'll leave that.
Should I...
All right.
Should I go on out?
Do you want me to hold it? Would
Yeah.
it be easier?
It would be easier,
Maybe.
yeah. Nice and steady. If you feel unwell, just sit down, OK? Let's get you on there first. Probably go up with legs as well, I think. That's it. Get your bum right up the top there.
Right at the top.
That's it. We have back.
Right up.
No problem. Right. Legs are going to go up, OK?
Yeah.
So just so you can put your head back a bit. See any problem? That's it.
Oh, that's better.
With Ronnie secure in the ambulance, George and Neil head for hospital.
So your liver problem, what is it? Is it liver cirrhosis?
Yeah.
Was that right in saying that?
Yeah, my GP seemed to think it might well be hereditary because my mother died of it.
Crying.
She was only 58 when she died. Yeah. I'm 59.
Yeah, no, it's not old at all nowadays. Not at all.
No.
After 35 minutes, Ronnie arrives at Worcestershire Royal Hospital.
My stomach's griping now.
Is it?
Yeah.
Yeah. Does that mean you might be sick or?
One of two.
Yeah, either way. Right. Yeah, okay. Nasty.
Oh, help me.
Okay, you're all right.
I think it's always a concern when someone starts vomiting blood because when's it going to stop?
Well,
because we've
yes.
seen it before, haven't we, where
Yeah.
people will vomit and they will vomit their
Yeah.
entire blood volume.
Yeah, and it's
in quite a quick time, and that.
And it's shocking to see. Just reassurance is the biggest thing en route, and get there quickly to hospital.
With Ronnie's medical history, doctors will want to investigate if her liver condition could be why she's vomiting so much blood.
Well, she wasn't very well at all, was she?
No.
She's got quite a serious bleed somewhere.
Yeah. It's been going on for a number of days, so I mean, that doesn't help things, but...
I'm surprised at how she looked, really, but hopefully they'll sort her out.
Exbury, somebody's got a poly bag over my head.
Yeah.
You know, only tight round here.
Yeah. And in that, by nature, it makes you feel more anxious about it, doesn't it?
In Worcester, paramedics Lisa and Danny are treating Stanley. He's been struggling to breathe with COPD. He's got a new oxygen machine, but using it has proved difficult.
Something reassuring though at the moment is that your oxygen levels are 94. No.
I think I'll be 87 to 92.
88 to 92 is our perfect score, so actually you're above that. So that's really, really good. So I think rather than it being like your oxygen level, because that's looking lovely, I think it's, we haven't quite got to grips, have we, with this breathing technique.
I think when Stanley was using his oxygen supply, he wasn't quite using the correct technique, so he was doing a lot of mouth breathing where he should have just took his time, took a deep breath in through his nose and then breathed out through his mouth.
Let's have a little listen to your chest, if that's all right. Well, good news is I certainly can't hear any crackles or any wheezes.
I think I'm just over-anxious.
Yeah. And I think that's understandable.
So it's really common for those with COPD to actually suffer with anxiety at the same time. It must be terrifying, actually, that you're not able to get your air in or feel that you can get your air in and that you can get your air out. So, you know, breathing in and breathing out is a basic. It's life, isn't it?
It's hard because you're adjusting to having the oxygen, aren't you? You're adjusting all the time. Because it's a progressive disease, it's always adjusting, isn't it? Oh, so you had COVID last month. I see. It's all making sense now. Right. So, if you had COVID the end of last month, we're probably, with your condition, still getting over that, if I'm honest. Oxygen level of 94%. I think that's
amazing.
Considering you've just had COVID, that's amazing, really.
And to be getting over that and feeling short of breath and adjusting to this oxygen and breathing techniques, there's a lot to do in one, isn't it?
Yeah.
I think a lot of our job is reassurance, I think, with every single patient.
I think even from Stanley just seeing us initially probably made him feel a bit better, just knowing that we were there, we had our equipment, and just we could start to make him maybe feel a bit better.
Looking at your numbers, really, everything is really good. If I'm honest with you, I can't honestly think there's much that they're going to do for you at the hospital. With you being so vulnerable with your lungs, I wouldn't want to expose you to any other infections, okay?
Just got to keep remembering to take those deep breaths through your nose.
With Stanley reassured and his oxygen levels stable, Lisa and Danny are happy to leave him at home.
You got any other questions, anything you're worried about?
Quite happy now.
Good, just that bit of reassurance.
Yeah.
Good.
Okay.
Yes, thank you very much, thank you.
You're welcome. Bye-bye. It must be horrible having a chronic condition. You just get so out of breath and worked up and you get into that cycle of not being able to control your breathing. Really scary.
COPD and anxiety are not a great, concoction, are they?
Yeah, glad with a bit of reassurance, though, it's brought him back to his normal breathing, and it's not easy, is it?
It's not. It's one of the more difficult ones to manage, I think.
A CT scan revealed that Jane, who was experiencing right-sided weakness, was having a mini-stroke. After treatment lasting 10 hours, she was able to go home. Ronnie, who was vomiting blood, was given a vitamin drip and a blood transfusion. She was discharged from hospital after 5 days. And Jessan, who was thought to have a kidney infection, was taken to hospital in considerable pain.
I got to hospital and they did an ultrasound, checked all my oxygen levels, just did all my observations, and they said everything's all normal. So they was kind of confused as to why I was in this pain.
But Jessan's pain only got worse.
A few days after I came home from hospital was when the numbness in my legs started, and that sort of spread slowly around to my whole legs.
Confined to a wheelchair, Jessan was eventually diagnosed with a rare neurological condition.
The diagnosis I've got now is functional neurological disorder. Your brain doesn't tell you that things need to work the way they should.
The cause of this condition remains a mystery, but its impact on Jessan's life has been considerable.
I didn't go to school for 14 weeks, and then when I did go back, it was part-time, so doing 2 hours a day. I'm a lot better. I can get out and I've been going out with friends and doing things that I used to do that I wasn't able to do for months.
In this series,
Hello, the ambulance.
we filmed over 1,000 hours of footage as our paramedic crews responded to emergencies across the West Midlands.
1, 2, 3.
But you didn't think you was going to be having baby at home, did you, today?
But life on the front line does have its lighter moments.
Paul, Abdul,
action,
snap.
I'm going to wet that one down.
Spit on me.
Come on then. Run. Let's go save lives.
I felt like one of those bobbleheads.
Yeah. Why not?
Busy, busy bee.
You lost sleep over
And
that.
well, I lost sleep over a few questions I got asked.
Oh my God, why is nothing working?
Do you have a career in TV, do you think?
Absolutely.
Ah,
No.
the newest hosts of This Morning.